This section of the film focuses on how the clinic first adapted to the pandemic and the way this clinic was able to provide the community access to the vaccine. Initial uncertainty was overcome by handling problems as they arose and by a willingness to stay flexible. Communicating information to patients and other providers was key. Strategies for facilitating vaccine access range from using the electronic health record to reach patients to helping coordinate large-scale vaccination events. Focused strategies addressed accessibility concerns for people with transportation challenges, limited workday availability, housing uncertainty through their Homeless Outreach Program, or HOP, and those with limited English proficiency. The healthcare workers provide insights on how the vaccine was given to the community from a point of view that might not be known to the general public. The strategies used may be relevant when considering equitable healthcare access in the future and ways to increase emergency response readiness.
Everything changed. And I remember writing up an outline of how we would work in that change and basically, responding to requests, services. And then I think there was a moment there where we offered, even providing like support, people could call us, whether it involved like cultural, ceremonial care.
With the clinic where I currently work, it's been evolving since the beginning. It started out as we weren't really sure what was going to happen, how big COVID was going to be. We still, know a little bit more, but not a lot more. So, really trying to get to know how this virus was working was very difficult at first, but it was definitely one patient at a time, treating them and figuring out what the next step would be.
One of the things that I did as a medical director for the community health center that I work at is to provide a monthly update about COVID. And so we would try to get together via Zoom with our colleagues and present as much up-to-date information as we had to try to sort of in real time keep people informed about both the science that we were experiencing and seeing and affecting our patients and ourselves.
So here at the clinic, we have a huge variety, an array of services, not only just medical, but we have almost 20 different programs. And so anyone that was in our database, in our electronic health record system that fit the criteria of the vaccines, they were contacted by phone, by text message, and by email, and they were asked if they were interested in receiving the vaccine. If they were, then they would be put into a schedule, and then we would actually have them come in.
From the beginning, we've done Johnson & Johnson, we've done Pfizer and Moderna, just depending on what we have in stock. We have offered it to everybody that wants it.
We did several large events where we were able to vaccinate 500 or 600 people at a time, while continuing to also do smaller, 15 or 20 or 50 people in our clinic a day, and kind of just meet the needs of the community as best we could.
The distribution, vaccination events, we were part of the planning, like the Indian Pueblo Cultural Center. We would, First Nations would provide like our physicians, and as well as the orders, go out to like the, different companies. And then of course my program, we would try to incentivize it, with food bags, bring people together as a distribution.
Work limitations, individuals trying to get off from work has been a challenge. And, that obviously interplays with childcare as well. Transportation is a problem that many of our patients deal with anyway. And so we have been able to utilize some resources, including outreach. Another thing that we have done is offered events on weekends, so that individuals who have work obligations are able to make it at that time. And we've offered them in different places so that individuals who, can make it through the bus or the transportation service one site can get there. We've also been really mindful and careful about allowing walk-ups and bike ups.
A majority of our clientele are homeless. So not having internet access, not having a phone, not having transportation, and then childcare, not so much. But those were really big factors. And then not only that, maybe some of them came in to get their vaccinations, like their first shot, and we have no way to get a hold of them for their second one, their booster.
And so with our homeless population, we had to get creative with them as well to try to bring them back for their second shot. And so once we were able to get the Johnson & Johnson, the one-shot vaccination, that actually was a good remedy for our HOP clients, because then we would talk them into getting it, and they actually went through with it. One of the biggest populations that we have here is English speaking, and then we have a Spanish speaking patient base. And so having all of our flyers and our information that went out to individuals, we had them available in their language that they were able to understand. So we have some individuals here that are pretty fluent in Spanish speaking, reading, and writing, and so we had them recreate a lot of the flyers and the brochures that we had.
And I know that they've even traveled places to give out vaccines. You know, our homeless outreach program has just been out on the streets, just looking for people, just, you know, and then they go to the West Side Shelter to make sure that everybody's vaccinated. It's open to the community. And so anybody can get scheduled for a vaccine. And I just think that we've been so responsive, and that's because of the amazing leadership. I hope that we've saved lives because of that.